The first step to a daily physical assessment is a general neurological examination.
Hi, my name's Hedy. I'm going to be your nurse today, and this is going to be Lacy. She's going to be assisting me. Can you tell me your name?
Macie Dan.
Okay. Okay, we're going to do what we like to call a head-to-toe assessment. Could you tell us a little bit why you're here today?
I actually passed out at work and I hit my hip.
During the neurological examination, check the level of consciousness of your patient.
Okay, and your birthday?
4/20/97.
Okay, do you know where you are?
The hospital.
Okay, can you tell me why you're here?
I passed out at work.
Passed out at work, okay. So when you fell, Macie, did you have any pain?
My hip hurts pretty bad. I hit my hip when I fell.
Okay, can you give me, like, 1 being the least you ever had, 10 being the worst pain?
Probably 7.
A 7? Alright, what are the vitals from you? We'll get going, okay? Alright, Macie, now I'm just going to get a couple vitals from you, okay? Go ahead and check your temperatures, so... Okay, you can go ahead and open your mouth and lift your tongue up. I'm going to stick it right underneath it and close your mouth and run it, okay? Put that one here. Make sure it's nice and tight for you.
During the neurological examination is a great time to assess your patient's speech.
Okay, 90 over 70. Okay, I'm going to check your pulses now. Okay, sounds good. Can you squeeze my fingers as hard as you can? Okay, good. Now I'm going to check your pedal pulse. I'm going to move this blanket.
Okay.
How are you doing today? Oh, okay. I was thinking that. Okay. I was like so sorry.
Next, check your patient's apical pulse.
Okay, next I'm going to check for swelling on your legs.
Check for edema by gently compressing the patient's soft tissue with your thumb over both shins for a few minutes. Observe for indentation.
Your skin looks real nice, nice and hydrated. Now if you don't mind, I'm going to go ahead and pinch right here. We're checking for dehydration in the skin. It looks good, it bounced right back. Now if you don't mind, we're going to check your lungs, okay?
Okay.
Okay, are you comfortable where you're sitting?
Mm-hmm.
Okay, good. We're going to check these. I'm going to have to slide this underneath your shirt a little bit.
Okay.
Okay, take a deep breath. Okay, another one. Okay, now if you can sit up just a little bit. Alright, we'll go ahead and slide this down your shirt. Breathe in.
While assessing the patient's lungs, have them breathe deeply in and out and check for crackles and wheezes. Check the patient's respiratory rate, rhythm, and work of breathing.
Alright, perfect. Go ahead and sit back. Lungs sound good. Hi, I'm Katie. I'm going to be your nurse today. Can I have your name?
Macie Dan.
Okay, I'm just going to be inspecting your stomach today. I'm going to lay the bed down.
Moving on to the gastrointestinal assessment, this is a great time to ask the patient about their diet, appetite, any nausea, vomiting, and diarrhea. First, start by inspecting your patient's stomach, then listen in all 4 quadrants for bowel sounds. Next, palpate the patient's stomach. Next, use percussion to tap on the surface to determine the underlying structure. Moving on to the genitalia and rectum assessment, determine if the patient has symptoms of vaginal discharge, painful or swollen tissues, or any lesions.
That out. You don't touch it. Okay. Macie, we're going to do some range of motion. Can you move your arms in a circular motion for me? And reach up.
And lastly, ending the assessment with range of motion exercises.
Put your chin to your chest. Move each leg. Now put the bedroll up and can you come towards me? Go over. And we'll do the other side. We'll roll this way.
Do you have any more questions for me?
No.
Okay, could you tell me your name?
Macie Dan,
And what's the date?
November 14th.